Hi, I'm Hillary Giannani. I'm the genetic counselor at Women's Hospital, and I work in hereditary cancer genetics. You may have heard that 1 in 8 women will develop breast cancer. You may have a family history of breast cancer, or you may have a friend who's had breast cancer. You may have heard of the BRCA or BRCA genes, and you may be wondering, do you personally need to be concerned about increased risk for breast cancer? There are several important things to understand about breast cancer. The first is that the vast majority of women who develop breast cancer do not have an inherited genetic mutation. In other words, their cancer is not hereditary. Only 5 to 10% of women who have breast cancer have a genetic mutation. This means, for example, if you take 100 women who all have breast cancer and you perform genetic testing on all of those 100 women, only between 5 and 10 of them will have a positive genetic test result. And the other 90 to 95 of those women will have normal genetic testing. So what does it mean to have a positive genetic test result? Well, we'll just do a little review of basic genetics. Our bodies are made of trillions and trillions of little tiny cells, and inside our cells are our genes. We all have the same genes. We have thousands of genes, and our genes come in pairs. We inherit one of every pair from our mother and one of every pair from our father. So we get half of our genes from one parent, half from the other. Each of these thousands of genes has a job in the body. And some of these genes, their job is actually to sort of help prevent us from developing cancer. They serve as a protective mechanism against cancer. And the BRCA or BRCA genes are examples of such genes. So in other words, the BRCA genes are not bad genes that cause cancer. They are good genes that normally help prevent us from developing breast cancer. And we all have these genes. We get one from mom, one from dad. What happens in about 5 to 10% of women who get breast cancer is that they have inherited a mutated BRCA gene or other such cancer protector gene, as I call them, meaning that the gene has a problem. It's not working quite right. So if the gene's job is to prevent cancer, but it has a mutation and it isn't working correctly, then that leaves that person at higher risk for developing cancer. And again, that only is the case in 5 to 10% of women who have breast cancer. The remaining 90 to 95% of women who get breast cancer don't have a genetic mutation, and their cancer is what we call sporadic, meaning it just happens by chance. It may be related to environmental factors or sometimes behavioral factors such as smoking. So how do you know if you need to be concerned about increased risk for breast cancer? Well, in terms of hereditary cancer, there are certain red flags that we look for in a patient's personal or family history that increase concern that they may be in this 5 to 10% that have an inherited genetic mutation. So those red flags include things like multiple people in the family with cancer. So not just 1 or 2 or 3 people in the whole big family, but multiple people with cancer. We tend to see multiple generations affected. So someone in the grandparents' generation and the parents and the child's, something you can see being passed through the family. We tend to see certain patterns of cancer. So rather than a breast cancer here, a colon cancer there, maybe a lung cancer, in these families with a gene mutation, we tend to see multiple relatives with breast cancer, or certain patterns like relatives with breast cancer and relatives with ovarian cancer. We also tend to see younger ages of diagnosis when there's a gene mutation at play. So really under the age of 50 is considered to be pretty young to develop cancer. So we look for that. And then we may also see things like individuals diagnosed with more than one type of cancer. So say a woman who gets breast cancer and then later goes on to develop ovarian cancer. And we are more likely to see rare types of cancer in these families. So in addition to breast, we might also see, like I've mentioned, ovarian cancer or pancreatic cancer. So those are some of the red flags that we look for in these few families that have a genetic predisposition to developing cancer. On the other hand, the vast majority of families that don't have a genetic mutation, you see more like random cancers, so maybe a breast, a lung, a colon. We tend to see ages of diagnosis in, say, the 60s or 70s. There's no real clear pattern, and we don't typically see people getting cancer more than once. So for example, if your maternal grandmother had breast cancer at 70, and your paternal grandmother, so your dad's mother, had breast cancer at 65, that is not concerning for a hereditary predisposition to cancer. We would consider that to be your standard sporadic family history of breast cancer. So if you have a personal or family history that you think is concerning for that hereditary predisposition, lots of cancer, younger ages of diagnosis, and so forth, you can ask your doctor to refer you to the Cancer Genetics Clinic here at Women's Hospital. It's run by Dr. Dwayne Superno. He's the geneticist doctor, and myself. And what we do at those visits is we sit down, we get a very detailed family history, and we can talk to you more about hereditary cancer and let you know whether you and or a relative may qualify for insurance coverage of genetic testing or not. The number that if you have questions about whether or not you may need to be seen in that clinic, you're certainly welcome to contact me. Again, my name's Hillary. I'm the genetic counselor. My number is 225-924-8310. Again, it's 225-924-8310, and I'll repeat that again at the end of the talk today. Now, another important thing to understand is that many factors affect breast cancer risk. A lot of people tend to think that if you have a genetic mutation, you have high risk for breast cancer, but if you don't have a genetic mutation, then you don't really need to be worried about breast cancer. But actually, that's pretty far from the truth. So genetics just play one role in breast cancer risk. There are a lot of other things that affect a woman's risk for developing breast cancer. So for example, there are hormonal factors. Estrogen, in a sense, sort of feeds breast cancer, if you will. So the more estrogen exposure we have as women, that can increase our risk for developing breast cancer. So the younger we are when we start our period, and the older we are when we go through menopause, that creates a wider window during which we're exposed to estrogen, and that can slightly increase our breast cancer risk. Our body mass index can play a role, so our height to weight ratio. Fat cells store estrogen, and again, estrogen can help sort of feed cancer. So the more fat cells that we have, the higher our risk for developing breast cancer. So body mass index plays a role. There are dietary factors can contribute. So I think hopefully most of us have heard that diet can play a role in cancer. Diets that are high in animal fats, saturated fats like butter and red meats, and then diets that are low in fruits, vegetables, fibers, whole grains, that can contribute to increased cancer risk. There are certainly environmental exposures, some of which we are aware of, so pesticides and other chemicals, some of which we may not really be aware of that are out there, but there certainly are environmental exposures. Behavioral factors like smoking. Smoking increases risk for cancer. Alcohol consumption can increase risk for cancer. Anything really over 3 alcoholic beverages a week is known to increase the risk for breast cancer. And then breast density can also increase our risk. So this is something that's out of our control as women, but some of us have denser breast tissue than others. And the denser our breast tissue, the higher the risk for breast cancer, and actually also the more likely it is that a breast cancer may be missed with screening. So you can see there are a lot of different factors that can affect breast cancer risk, aside from genetics. Now we have what's called a risk assessment tool that we can use. It's like a computer program. It's called an IBIS, and it can help estimate a woman's risk for developing breast cancer in her lifetime using some of these other risk factors that I've just previously discussed. So for example, this risk assessment tool, the IBIS, it can take into account Well, first of all, it does take into account the family history, so number of female relatives or male in the family who have had breast cancer. It takes into account our hormonal factors, age at which we start our period, go through menopause. It takes into account breast density, and it can calculate an estimate of that woman's lifetime risk for developing breast cancer. If that estimate is at 20% or higher lifetime risk for getting breast cancer, that woman is considered at high risk for getting breast cancer. And this can be the case even if she doesn't have a strong family history, because again, it's taking into account all these other risk factors for breast cancer. If a woman has a 20% chance or greater risk for developing breast cancer based on the IBIS, then she qualifies for increased breast cancer screening. So in addition to getting an annual mammogram, that woman would also qualify for an annual breast MRI, which we do in addition to the mammogram, and we usually alternate those every 6 months. So for example, she would get a mammogram, 6 months later a breast MRI, 6 months later a mammogram, 6 months later an MRI, and then they also should be getting clinical breast exams by a doctor every 6 months as well. So that's something that we have available at Women's Hospital. We have a high-risk breast cancer clinic where they can oversee this increased breast cancer screening as well as increased frequency of breast exams, just to make sure that we're keeping a closer eye on these women that have increased risk for breast cancer. If you think that you may have increased risk for breast cancer based on these factors, or you're concerned and you want to talk about it further, you can have your doctor refer you, or you can call directly to the women's breast specialist. It's 225-216-1118. That's 225-216-1118. And you can get scheduled in the high risk screening clinic here at Women's Breast Specialists. I do also want to add, this talk is really about breast cancer, but it is also important to understand that there's a lot more out there than just breast cancer. There are other types of cancer that can be hereditary, or that can give us clues that there may be a hereditary gene mutation in a family. So for example, if we have a family that has an individual with ovarian cancer, that's ovarian specifically, not uterine, not cervical. But if there's a family history of a true ovarian cancer, that can increase concern for hereditary gene mutation. Pancreatic cancer is also a concern for hereditary gene mutation. So if there's any pancreatic cancer, that needs to be addressed, as well as certain forms of prostate cancer. So prostate cancer is very, very common, but certain prostate cancers, particularly those that are aggressive and those that metastasize or spread to other parts of the body, that can be concerning for hereditary gene mutation. Particularly if we see any or all of these cancers in combination. So if there's a family history of breast and ovarian and metastatic prostate cancer, that can be a concern and would warrant further genetic counseling so that we can investigate whether anyone in that family may qualify for genetic testing to see if we're talking about one of those families that has a genetic risk. As a side note, if we do find a family that has a genetic mutation, we do some pretty extensive counseling on everything that family needs to know about that. What are the types of cancer the family has risk for? What are the levels of risk? What type of screening is recommended because of that risk? And how does that risk affect the family, the extended family, the siblings, the parents, the children, and so forth? So that's all stuff that we can address in the hereditary cancer genetics clinic. Well, I hope that this talk has been a little bit helpful as far as thinking about the difference between sporadic cancer and hereditary cancer, and understanding that genes is not all that contributes to cancer risk. There are a lot of other risk factors that need to be taken into consideration. So again, if you have concerns that you have a family history with some of those red flags that you think may indicate a hereditary gene mutation, you can call me directly. My phone number is 225-924-8310, and I can help get you scheduled in that cancer clinic. If you don't really have those red flags that might indicate a hereditary predisposition to cancer, but you think you may have increased risk for other reasons, maybe an increased BMI, maybe you started your period young, you went through menopause late, you've been told that you have dense breast tissue, or if you're just not really sure if you should be concerned or not, you can have your doctor send a referral to the high-risk clinic, or you can call directly. With both of these clinics, generally people have their doctors refer them, but we do technically take self-referrals. So if you want to get in touch with a high-risk breast cancer clinic, again, that number is 225-216-1118. Thank you for watching today's talk, and we're always here and available to help if we can.